Hello everyone, my name is Anho and I'm from Department of Biomedical Science and Engineering. Today I will present our team project. The title of the project is Anti-TFG beta, a novel treatment for COVID-19-induced lung fibrosis. Firstly, I will introduce the up-to-date treatment for COVID-19. The COVID-19 pandemic have created the worldwide public health emergencies and have a significant impact on dimension of health. As we know, the symptoms of the COVID-19 patient quite diverse from no symptom to mild and severe symptoms. Moreover, there are some novel treatments such as serum therapy, monoclonal antibody therapy, adaptive immunotherapy, or antiviral drugs. In particular, most SARC patients with fibrosis lung damage recover within the first year and then remain healthy. However, in 20% of the case, significant fibrosis progression will fall in 5 to 10 years. The incidence rate of post-COVID pulmonary fibrosis can be estimated at 2 to 6% after the moderate illness. And SARS-CoV-2 induced pulmonary fibrosis is not only one of the important clinical manifestations, but also a more common second in the convalescent state of the disease. So what is the pulmonary fibrosis and how it affects human health? As you can see here, when our lungs are inflamed, acute or chronic, the alveolar epithelium cell will be damaged here, and then it will release some the inflammatory cytokine, for example, like TGF-beta, TNF-alpha, interleukin 6, and then it will activate the fibroblast and myofibroblast. And in the end, it will be formation of the collagen in the in our lungs, and it can make our lung abnormal function or lose the function. And it's well known that the sentinel cell played an important role in fibrosis pathologies. So what is the sentinel cells and how it contributes to the fibrosis pathologies? And we can see here when the normal cell have the stress or damage, our immune system can it can clear the damaged cells or the die cells. But when we get older, the normal the damaged cells cannot be cleaned by our immune system. Then it will be the damaged cells will become the sentinel cells. The sentinel cells will not die but cannot divide, and they call this the cellular senescence. And the sentinel cells can relieve some the chronic inflammation, SAAP. And we can see here when the epithelial cells in our lungs damage, it will occur the primary senescence process, and it can lead to another cell become the senescent cells and relieve some chronic inflammation. Especially the TGF-beta, when it relies from the senescent cells, it will bind to the TGF receptor 2 and then phosphatase the TGF receptor 1, and then it leads to the downstream process, and finally the myofibroblast activation and matrix deposition. And you can see in the picture here, this is show the pulmonary fibrosis in our lung, and you can see in the raised image here, the white here is show for fibrosis in our lung. And in paper of the 2C, it shows that SARS-CoV-2 infection triggered the paracrine senescence. And then they use the cells in our lungs and then infect with the COVID-2 and then collect the supination after 6 days, and they check the immunofluorescence, and you can see here the P16. This is the biomarker of the serum cells, and this MOC, they compare between MOC group and COVID-2 group. MOC group is mean control group, and this is group which infect COVID-19. And then you can see here in the COVID-2 infect group, it's increased the P16, and this is also here. You can see after the 6 day treatment with infect with the COVID-2, the P16 increase significant if compared with the control group. And moreover, when they treatment with the TNF inhibitors, you can see the level of the P16 is decreased if compared with non-treatment COVID-2 infect group, and it's so here the increase significantly. So from that we can see like the SARS-CoV-2 is when it's infected to our body, our immune system will realize the TNF alpha, and TNF alpha will make the normal cell become the sentinel cells, and and sentinel cell in turn will realize the TGF-beta, and this can lead to the lung fibrosis. So combined together, we hypothesize that. So if we use the drugs to inhibit the TGF-beta, whether we can reduce the lung fibrosis or not?
It's an experiment set up to confirm our hypothesis. First, we are going to do an experiment with control group, SARS-CoV-2 infection group, and anti-TGF-beta treatment group. SARS-CoV-2 infection on day 1, and anti-TGF-beta treatment for 6 days. On day 8, histology and micro-CT scanning will confirm lung fibrosis. When TGF-beta bind to TGF-beta receptor 1 and 2 form heterodimer. Then TGF-beta receptor 2 phosphorylate TGF-beta receptor 1. Therefore, the phosphorylated TGF-beta 1 is recognized by other signaling protein, and the signal is transmitted downstream. TGF-beta has several functions in our body. For example, macrophage recruitment and activation, epithelial cell extracellular matrix production, T-cell activation, differentiation, endothelial cell apoptosis, pro-angiogenic, and mesangial cell and fibroblast proliferation. Therefore, when all TGF-beta is inhibited, various side effect occurs. So we are going to treat TGF-beta antagonist specifically to the lung with inhalating treatment. Thank you for your attention.